Okay. Are we there? Can everybody see that now?
Yes, very well. Okay, I'm going to hush.
Okay. Okay, no. Thank you for your help. Like I said, I've never been put in control of that before, so I appreciate it. And thank you to everyone who is here watching on behalf of the Arkansas Heart Hospital. And thank you to all you fine ladies and Vicki Wingfield for inviting me with you today to talk about autoimmune disease and the heart. All right. Forward here, trying to advance. The immune system normally guards against, yes, ma'am?
No, go ahead. You got it.
Okay, sorry. The immune system normally guards against germs like bacteria and viruses, but when it senses these foreign invaders, it sends out an army of fighters to attack those cells. And normally it's the difference between foreign cells and our own cells. So in an autoimmune disease, there is self and non-self antigens. The self antigens are targeted inappropriately to oneself. And here the immune system makes the mistake as part of our own body, like our skin or joints being foreign, and it releases these autoantibodies that attack healthy cells. For non-self autoimmune disease, the foreign antigen is, of course, considered our non-self, like a virus or a bacteria, and that triggers an immune response as well. So immune responses are divided into two different type of categories, if you will, innate and adaptive. Innate is an immune response that comes from an infection or as it says, trauma or stress, like a rheumatic fever or rheumatic heart disease, while an adaptive response is a slow and sometimes insidious process that can target an organ or the whole system. Like one organ that can be targeted for type 1 diabetics is the pancreas, or in a systemic process like systemic lupus erythematosus, where the whole body is involved. So what increases my risk for autoimmune disease? We don't know exactly what causes the immune system to misfire, yet some people are more likely to get autoimmune disease than others. According to a study in 2014, women get autoimmune disease at a rate of about 2 to 1 compared to men, and especially in what they consider women's childbearing ages, which they list as 15 to 44. Some autoimmune diseases are more common in certain ethnic groups. For example, lupus affects more African Americans and Hispanic people compared to Caucasians. Certain autoimmune diseases like multiple sclerosis or lupus run in families, but not every family member will have the same disease, but they will inherit that susceptibility for that autoimmune condition. Because of the incidence of autoimmune disease and its rising, researchers suspect that environmental factors may be playing a role, like infections, exposure to chemicals or solvents that lead to the autoimmune disease. A Western diet is another suspected risk factor for developing autoimmune disease. Eating high fat, high sugar, highly processed foods is thought to be linked with inflammation, which might set off an immune response. However, this hasn't in full been proven, but it's theorized. In 2015, a study focused on another theory called the hygiene hypothesis, because vaccines and antiseptics being used, children today aren't exposed to the germs that they were exposed to like when I was young and in the past, and the lack of exposure could make their autoimmune system prone to overreact to some of the harmless substances. Signs and symptoms depend on the type of autoimmune disease and the body systems affected. Symptoms may be mild or severe and may come and go. You may have many of the following symptoms if you have an autoimmune disorder. Here are some of the autoimmune diseases that can affect the heart. Oh, sorry, let me go back. Atherosclerosis is considered an inflammatory disease. You know, everybody talks about cholesterol and plaque buildup and all, but it is considered a chronic inflammatory disease, and many consider it an autoimmune process, and it's an adaptive. It's a process that takes place over a long period of time for the plaque to form and narrowing of the vessels to occur, or inflammation that causes plaques to rupture and heart attacks. Rheumatic fever, rheumatic heart disease, recurrent strep throat infections can lead to heart valvular disease. And this is more common in people who are young. Excuse me, it's most commonly acquired for people who are under the age of 25. And it can lead to shortness of breath and chest pain and fatigue and irregular heartbeat and fluid, fluid accumulation. Rheumatoid arthritis is another adaptive inflammatory response. For people with rheumatoid arthritis, the risk of dying from cardiovascular disease is up to 50% higher than in the general population. It doesn't mean that you're automatically doomed to have a heart attack, but you need to be treated to reduce body-wide inflammation and be encouraged to choose a heart-smart lifestyle. Systemic lupus erythematosus. Heart disease is a major complication of lupus, and it is now a leading cause of death among people with lupus. Pericarditis is inflammation of the sac around the heart that can lead to symptoms of sharp chest pain and shortness of breath. Myocarditis is inflammation of the muscle of the heart and can lead to symptoms compatible with fluid overload, of shortness of breath, difficulty breathing if you're lying flat at night, swelling in the feet or ankles. Endocarditis is inflammation of the inner wall of the heart and valves of the heart that can lead to shortness of breath as well, and decreased exercise tolerance. And then atherosclerosis, which of course decreases blood flow to the heart itself. Type 1 diabetics have an autoimmune response, antibodies that attack the pancreas. People with type 2 diabetes have insulin resistance that I like to describe as the body, the pancreas producing keys, and you have all the keys floating around, and the key is to unlock a door on every cell so that sugar leaves the bloodstream to go into the cell to be the energy source for that. People who have type 1 diabetes have antibodies that attack their pancreas, the cells in the pancreas that produce insulin, and insulin I like to describe as like the Pac-Man phenomenon. So these people lose their insulin producing ability. Sometimes you think type 1 diabetics are born with that, but it actually can occur over time with these antibodies and this slow process of attacking the pancreas, like many autoimmune diseases do. So we see a lot of people in endocrinology who come to us who were diagnosed as a type 2 diabetic, but are actually type 1. And maybe they're in their 30s or 40s and they had enough insulin production and not as aggressive antibodies attacking, but they no longer produce insulin to do that job of moving sugar from the bloodstream into the cell. And of course, we know the number one killer of diabetics is cardiovascular events. Psoriasis. People with psoriasis have a chronic autoimmune skin disease that speeds up the growth cycle of skin cells. This inflammation increases the likelihood of having calcium and plaque build up in the arteries and can lead to coronary artery disease. Graves' disease is an autoimmune disease where the thyroid becomes overproductive and you become hyperthyroid, which can lead to rapid and irregular heartbeats. The heart can overwork itself over a period of time and weaken the heart, and it can lead to, along with the increased heart rate, shortness of breath and decreased exercise tolerance and fatigue. There are many ways that we can diagnose an autoimmune disease, as you see here with blood tests, scans, x-rays, and sometimes a biopsy, or aspiration of fluid is needed to determine if indeed you are having an autoimmune process. Treatment, of course, depends on what's causing the process and what all's involved with the body, if it's systemic or localized. There is an autoimmune protocol diet. Autoimmune diseases are thought to be caused by a variety of factors, like I alluded to earlier, some including genetic propensity, infection, stress, inflammation. If you hear that over and over again, it's an underlying cause in some medications. Some research suggests that in susceptible individuals, damage to the gut barrier and leading to leaky gut can cause autoimmune disease. And certain foods are believed to possibly increase the gut's permeability and lead to that leaky gut. So for people who want to look up autoimmune protocol diet, it is similar to a paleo diet. And so you can look up information with regard to that type of diet. So if you have an autoimmune disease and what we've talked about today, you think, oh my gosh, this is bad. It's going to end up and I'm going to have some cardiovascular event. But it, of course, it's not the end. It's just the beginning as you understand why you're having the symptoms, what your body is going through, and you find out the right way to curtail this process that's going on and to treat what your body needs. Okay, are there any questions that anybody has?
I'm sure there are. And if you want to go ahead and stop sharing your screen, you can see more
Yes, ma'am.
faces. So I'll be helping you ask your questions if you want to raise your hand, or you can just unmute your mic and go ahead and ask your question. We've got lots of time to do that, and I'm sure we have some. Dinah has her hand raised. Yes, go ahead, Dinah.
Thanks. Well, I was diagnosed with rheumatoid arthritis in
Yes.
September, but I had a really horrible summer before I could get to a rheumatologist. And I was wondering if you could talk more about leaky gut. And because I've been trying to convince my two rheumatologists I've seen that this is going on, but they're not trained to know even what I'm talking about. So I'm very frustrated about this, and I've tried to educate myself, but are you a good source, or is there a good source on this? Thank you.
Thank you for the question. It's very good. You know, when we talk about leaky gut, it gets into the microbiome of the stomach. And,
Right.
you know, they consider the stomach the second brain because of the microbiome within the stomach.
Right.
So that being said, it takes my mind to the old adage that you are what you eat. And these highly processed foods, the high fat, the high sugar foods can alter the gut microbiome. And you know, the microbiome works on a feedback system with the brain, and there is a lot that goes into the microbiome. And I think that's where, when we talk about leaky gut, that's actually what we're focusing on, is the microbiome, because a lot of things that the brain sends out for nerve impulses, for communication with the rest of the body, people can develop or have developed depression because of negative feedback they get from the stomach going up. So there is a lot about the microbiome and that. And leaky gut, I think, is a way to describe better the microbiome and the effect of how diet can impact that. My recommendation would be to talk to a dietitian. We have registered dietitians on staff. We're happy to get you an appointment if you would like. Ms. Vicki can get you hooked up from that standpoint to talk more about foods that lessen the inflammation, because that's what the whole ticket is about. And there are a lot of hormones in foods, as you know, and you can see on packaging and be aware of. And those all change the microbiome. So getting with someone who would be more expert about specific dietitian and macronutrients and probiotics would be of benefit from that. And I think the registered dietitian would be your great source for that.
And this has come up a couple times. Nutrition, we're having a class right now at LifeQuest, the whole foods plant-based diet.
Excellent.
And it has raised a lot of questions in almost every session. It might be a good idea, don't you think, Dinah, if we had maybe their nutritionist, their dietitian speak?
Yeah,
Yes.
We could do a whole program just on that, so from.
good idea.
Yes.
Yeah, I think you raised a
Yes.
good point. What other questions do we have? We have a written question with COVID, and I have asked this question to our previous physicians that have presented from Arkansas Heart Hospital as well. But with COVID being an inflammatory virus, are you seeing an uptick in autoimmune cases, and how might those affect the heart?
So yes, we have. Definitely, we have seen more uncontrolled malingering diabetes, and some reclassification of people from type 2 to type 1 diabetes. We've seen probably more so from a thyroid standpoint, people becoming hypothyroid. And so the inflammation with blood clots, we have seen that more so. And from a heart weakening standpoint, decreased like almost a myocarditis, if you will, some inflammation and congestive heart failure coming from COVID. So there is a lot that has changed from a COVID standpoint. So yes, I know a first thought was not about maybe an autoimmune process, but COVID has kept a lot of people from seeking heart treatment. And so interestingly, there was an increase in the rate of heart attacks, particularly fatal heart attacks, from people delaying their care because of the fear of acquiring COVID by going to the hospital. So I think there's a lot more to come from the effects of COVID once data can be, analyzed and looked. But definitely, yes, that is an excellent. And yes, things have changed from a coronavirus standpoint.
Okay, let's see. Lindy had a follow-up question. Do you want to ask your question, Lindy?
Yes. Okay, with these COVID-related side effects that you're seeing in the autoimmune, is that something that is coming close to the COVID diagnosis? Or are you seeing it later on down the road?
So some have occurred within the 1 to 2 months following that. Some of the symptoms are very familiar and malingering, this adaptive response, and some are more innate with regard to blood clots. So I think there's the broad spectrum of all of that, and people just not being able to, quote unquote, get over the hump from their COVID infection. Some of the latest research studies I've read show that for every day you're forced to be in the bed sick, it takes 5 to 7 days to rehab back. And so if you think about that, people are just putting awful lot on just the malingering effects of COVID, but the immune, the endocrinology system is all a feedback from the pituitary, the master gland in the brain. And so some of the glands like thyroid or our reproductive glands, it's not as important, as we have to keep up with production of insulin and cortisol and some things. So some things take a back burner, the survival of the fittest type things back to Darwin days. And so some of these things have just been on the back burner, and it's the body's still struggling to get healthy and well. So yes.
We had a general question about heart failure, and I know that that is a passion of yours.
Yes.
In your work. Can you describe what that means, and what do you do in your practice about that?
So congestive heart failure can be due to weakening of the heart or to thickening of the heart. So some people can have congestive heart failure, and maybe they've had a heart attack, or they've had some valvular disease. They've had some virus that weakened their heart, and their heart doesn't pump as forcefully, as vigorously to empty its chamber. So the heart and plumbing, if you will, if a cup of blood goes into the heart, a cup needs to be pumped out. And if the pump isn't strong enough to sustain that, then the fluid gets backed up. And of course, one of the first places, that blood goes from the lungs is to the heart. So when the blood gets backed up in the heart and the heart can't continue to pump forward, then this backing up process leads to pressure changes in the lungs, and you develop fluid that accumulates in the lungs. And symptoms that go along with that are weight gain, shortness of breath, of course, is primary. You might develop a dry, hacking cough when you lay down to sleep at night. You can't breathe. You have to prop up on pillows, and the swelling that goes along with that. And for people who maybe have had high blood pressure for a period of time, their heart muscle is thickened to try to overcome that high blood pressure resistance. And it changes it narrows the chamber, the amount of area in the heart chamber for blood, because the muscle is thickened. And the theory too is the same, that there's not enough room in the heart for the blood to come. So you've got a cup coming in, but maybe it can only hold a half or 3/4 of a cup. So then you've got extra blood left over, and that backs up in the lungs as well. And so medicines now have really changed from a congestive heart failure standpoint. Once you have congestive heart failure, it doesn't mean that you're always going to have it. For some people, it is always a problem that they have to day-to-day watch for. Limit salt in their diet, because salt makes you cling to fluid. Limit the amount of fluid that you intake. And of course, medications are usually involved to try to slow down the heart, to allow it to feel before it empties. We have medicines now from a diabetic standpoint, like the medicines that Jardiance and Farxiga, that class of medicines that not only help from a diabetic standpoint, but also help to decrease fluid accumulation, increase mortality, increase quality of life. So there's a lot that have gone on. Devices, there's a lot. So seeking someone who treats that will certainly help out from a congestive heart failure standpoint. But that's another thing too that can be, because diet is very important in that. Going back to having a whole episode, if you will, a whole production would be very beneficial, because diet affects everything.
I think Vicky's getting that message. We'll be bugging Vicky about more on that. Dinah, did you have a follow-up question? I noticed in the chat. Do you want me to ask it? Okay, she's frozen. So, go ahead. Okay, I'm going to ask it. She's frozen for a second, but so I'll ask your question, Dinah, and then you hop in if I didn't get it right. But it was about cholesterol medications. she asked, are there
Okay,
certain,
go ahead, Leah.
okay, we keep talking over each other. She asks, are there certain anti-cholesterol drugs that are worse than others? And is there a way to know if one has a total cholesterol level of like 256 for several years, do you actually need medication?
So there is debate about the cholesterol medicines, and is it really about cholesterol? And of course, that is a great question, especially with what we've talked about with all these underlying inflammatory properties. So our liver makes cholesterol. We need it for cell membrane production, hormone production, neurological, myelin sheath, and all that. But sometimes we can overproduce cholesterol. And so in some of the studies, like the Framingham heart study, one of those benchmark studies, they found high cholesterol in that population of people. Now they're looking and following Framingham and maybe doing some recalculations to see about this inflammatory process. So the statin drugs, although they decrease the cholesterol production in the liver, also help to decrease inflammation. And so there's a process that can go on in the inner arterial wall, that inner layer of oxidation, whereby you can start plaque formation on there. And statin drugs are supposed to lessen that, that inflammatory process and lessen plaque formation. They also, the statin drugs are also supposed to lessen the risk of plaques that are there. That it helps to stabilize the plaque. They've done looked under the microscope of people after they've taken plaque out from the cath lab of people who have gone in with heart attacks, and they see the plaque composition of being this red orange hue color, as opposed to people who had maybe 90+% blockage of an artery. Their plaque is unstable. So statin drugs are supposed to help stabilize the plaque, change it from that red orange hue to that yellow hue, and lessen the risk of fracture and heart attacks. They have injectable medicines out that drastically lower for those people, lower cholesterol and bad cholesterol for those people who can't tolerate statin drugs. But there is a debate about, is it really about cholesterol or is it about the inflammation? So you're right on that as well. So it's all about inflammation. It's all about inflammation. So excellent questions.
Thank you. Thank you.
Yeah, this is a pretty savvy group of people. We're peppering you today. We're all over the map.
I hope I'm answering the questions that you need.
Well, I'm going to ask you a question I've asked our other guests. Do you have a success story? You mentioned that some of these conditions are reversible. And do you have a patient in mind or that comes to mind in which that has happened and that there has been some return to a better quality of life or better health?
Oh, definitely. I don't know that I can say one thing in particular. For changing from cardiology, doing diabetes and endocrinology, and in particular diabetes, it has been a drastic, the bonds with people who come in are much closer now. And my role as being a cheerleader and someone to educate and put tools in your toolbox seems more, I don't want to say it's more important, but it allows people to have that knowledge and that power from that knowledge, that they see why they need to make a change and they want to make a change. And that is the impetus for all of it, is trying to motivate you to try to alter the course, to chart your path, and to be the best and healthiest version of yourself. People want quantity, but they also want quality with that quantity. And that's what we're striving to do.
Yeah. That's a great role, to be the cardiac cheerleader, especially here in Arkansas. We're not up there in high tiers of health and weight and
Right.
lifestyle choices often. So I'm thrilled. What other questions do we have? I know we have some members in our group that have some experience themselves with heart disease and autoimmune diseases as well. I have a question in the chat. Please ask about how celiac disease affects heart disease. What is the
So
relationship?
celiac disease, leads to malabsorption of, and the first thing that comes to mind with that are people who have electrolyte imbalance and you don't get in or can take in enough potassium or magnesium that can lead to heart rhythm disturbance. And again, it's an inflammatory, goes back to inflammation, an inflammatory response on things as well. So, but malabsorption of in particular for some medications. So that gets into just the malabsorption of many things, not just medications, but foods and vitamins and minerals and electrolytes.
You keep saying inflammation, and it all comes
Yes.
back to inflammation. That seems to be
Yes.
a real root cause. What is on a system level what is the body's response when different organs or system wide becomes inflamed? What's going on?
So with that inflammation, it is like if you want to think of things as being angry all the time, and fractious, and leading to changes on that inner lining of the arterial wall, which then increase the risk of blood clot events and heart attack events or stroke events. Blockage that may be there, plaque fracturing.
Mm-hmm. So angry, I can understand that.
So a lot of it is like that, and it's just not targeted like for diabetes at one thing. It's a whole systemic process.
Yeah.
So there is no stopping point to it.
Is that one of the reasons why autoimmune diseases in particular are so hard to diagnose? Because the inflammation can, from skin rashes to heart palpitations to aching joints to digestive trouble. I mean, it seems like inflammation could be everywhere or anywhere.
Correct. And it is so insidious. Some people just start, it's such a slow process for some that you start believing that's the way. You don't know how bad you feel until you can get feeling better, until you start feeling better again.
Yeah. I'm wondering if the Bashes had a question, Dave.
Trying to get to it.
Go ahead and ask your question.
Oh, okay. Are you? Can you hear us?
We sure can.
Okay.
Yeah.
Well, we often hear the recommendation that a low dose aspirin. We've been talking about inflammation. We often hear the recommendation of a daily low dose aspirin to decrease inflammation and hopefully decrease cardiovascular events as well. But there is some recent information that said it might increase brain bleed. So what do we do?
It might increase what? I'm sorry, I missed that.
Bleeding in the brain.
Oh, there is a risk of that because what aspirin therapy does, it's, next to steroids, one of our strongest anti-inflammatory medications, but it alters our platelets, which are the components in our blood to help form blood clots. And so it can increase that risk. And then you have to look at underlying things like high blood pressure, which can increase the risk of bleeding in the brain, particularly if you're someone who has little small aneurysms in the brain that you're not aware of. So a lot of studies have been done about aspirin and decreasing risk of heart attack or stroke, but it does have that bleeding possibility to it, just like every medicine has, it's the double-edged sword, has its benefits, but also has its potential side effects. So you have to look at the risks versus the benefits of taking aspirin, and then what other medicines you are on, because they can potentiate the effect of aspirin if you're on other blood thinning medicines. So it is certainly something to discuss with your care provider about aspirin therapy, and if it would be indicated for you to help decrease inflammation and lessen the risk of heart attack and stroke and cancer as well. So it's definitely something to talk to with your care provider.
Yeah, it's pretty clear that you should do it maybe after the first heart attack, but the real question is prior to the first heart attack, right?
Correct. They've done, there was a study, the Physicians Health Initiative, Health Initiative study. I can't remember exactly, but it was a study that in the sample population had physicians and had respiratory therapists and nurses, a lot of healthcare professionals looking at aspirin and when you should start taking aspirin and what dose of aspirin with regard to bleeding, the risk that you brought up. And so in the study, men at the age of 40 and women at the age of 50, and an 81 milligram was enough to suffice and lessen that risk for thrombotic, for blood clot events. And that was from that study.
That is interesting. Jean, you're unmuted. Do you have a question?
Yeah, you mentioned before about an injectable statin. I had been on oral statins for a while and had to come off because of adverse reactions. Would the injectable still give me the adverse reaction?
It's a small chance that it could, but usually people tolerate it much better. Repatha is one of those medicines, and now I'm blanking on the second. And they are usually twice a month injectables every 2 weeks. And I'm trying to think of the other medicine besides Repatha. But usually they're very well tolerated and do a markedly better job than the statins do, actually, with regard to lowering the numbers. Gosh, I can't believe that I'm blanking on the other medication with that.
That makes me feel better, just that you're blanking on.
Oh gosh.
Well, we've put you on the spot here. We didn't have a prepared list of questions for you, so I appreciate you.
No. Repatha, those fall under the category of PCSK9 inhibitors.
Okay.
And so they don't fall under the category of statins, if you will, but there are two of them that are available. And they do a phenomenal job. They're pricey, and usually you have to have documentation of all the statins you tried and were unsuccessful with, and maybe some underlying other, conditions to try to improve the success of you getting that. But those PCSK9 inhibitors, it's amazing how well they lessen the total cholesterol and the bad cholesterol, the low dense lipoproteins, those tight little cholesterol particles that are most likely to form plaque.
Well, I've been off my statins and my diet does not warrant high cholesterol, but my parents are my response from it. Their genetics just passed right down to me with everything bad.
Yeah,
yes, ma'am.
It's the gift that keeps on giving. We are out of time. We are out of time. Dinah, did you have a quick comment?
Oh, I just wanted to thank her for mentioning this class of drugs, because I didn't know about them, and I've tried all the statins and had all the side effects. So thank you. May try that.
It's very common. And so the PCSK9 inhibitors, Repatha, and its other competitor,
Uh-huh.
which I will think of probably as soon as this is done, but I'll let Vicky know so that she can share with everybody.
I know, as soon as we're over, you'll think of it. That's fine. Mrs. Bash, did you have a quick comment?
Just wanted to say that this has been an excellent program. I think you have been the best informed person we have had come from the Arkansas Heart Hospital.
Ooh, that's
We
a high
really
bar.
appreciate that.
Well, thank you. Thank you very much. I'm happy to help out. I always say if there's one thing you take from it, that's it can be a springboard for many other things. So
We also wondered, those canine inhibitors, would that keep
Yes.
the dogs away?
Clever.
Sorry. Sorry.
I still think people have their pets right with them. Now, I can tell other stories of people who had the weak heart and defibrillators went off and their pets were in their laps and were a little skittish about going back into their owner's lap. They got back in there, but it took a little time for that.
I bet. What a shock, huh? I really appreciate you being with us today. It is such a gift to have Arkansas Heart Hospital and for us to be able to have this conversation, which is just a rare thing with physicians and experts in your field. And it is a real gift to LifeQuest. This is recorded, so you can share this publicly. It's on our public LifeQuest of Arkansas Facebook page. And feel free to share this recording with friends and family and have them tune in, because we want to get the education out. Arkansas Heart Hospital is a sponsor of LifeQuest, and as you can see, they take their job very seriously and are educational partners with us, and we really appreciate them for doing this. We're getting lots of a thumbs up and chats saying thank you so much. This is an excellent program, and it really is. We appreciate you, Dr. Crowder, for being with us.
Oh, it's my privilege to be here. Thank you very much for having me.
Okay, thanks everyone. We'll see you next week. We have one more in February, Heart Healthy Month from Arkansas Heart Hospital. Thank you, Vicki, once again for coordinating and being a partner with us. Thank you, Dr. Crowder. Have a great rest of your week. Stay warm, everyone.
Okay, thank you.
Thank you.
Thanks.
Bye-bye.
Bye-bye.